Hello there. I've recently had some work done on my neck, and before I had it done, I met with the surgeon's office, did a search of YouTube, and wanted to find out a lot more about what was going to be done and what recovery was going to be like. So I decided to make this video, and I'm planning on doing further videos as well as I'm further along. So the work done on my neck was a disectomy of C5 and C6, as well as C6 and C7. So that is the removal of 2 discs, and that was followed with spinal fusion of the cervical vertebrae C5, C6, and C7 with a titanium plate and 6 screws. So here it is on Sunday, and that was completed this past Wednesday. So I'm already at home, and yesterday I arrived at home from the hospital. The surgery itself, I don't remember obviously anything of that, nor much about the recovery in the recovery room afterwards. The surgery was approximately 4 hours in length. It was of course general anesthetic, and I was fortunate that they did not have to do a bone graft from my hip. What they typically do is when they remove the disc, they try to suction and collect the bone chips as they're working, and then use that to place in, I think it's the plastic spacers, in place of the disc, so that new bone can form. If they have sufficient bone collected just through that process, it's essentially limited to your neck. I did wake up with a bunch of pen marks on my hip, but no incision there, so I was quite fortunate in that regard. The recovery itself, I'm guessing I spent probably 2 or 3 hours in the recovery room itself, just next to the surgical suite, and I recall absolutely nothing of that, nor of the transport to my hospital room. The hospital room itself, once I came to and I could really start paying attention to surroundings, my wife was there, and I wasn't feeling too bad. Pretty hopped up still on medication. Very, very woozy, and nauseated as well. So as time progressed, the next few hours, I started to feel a great deal more nauseous, and in fact I was nauseated to the point of vomiting 4 times. Excuse the cough. So that's something I had to deal with. It was partially to do with the general anesthetic, which I did not react very well to, and the morphine for the pain. So after that was pretty much cleared out of my system, the nausea itself greatly diminished, and it was just the pain I focused on, and it was pain in my neck, which is, I guess to be certain, is that the back of the neck is what aches a great deal, and then I had quite a bit of pain in both shoulders. I knew that would be coming just from the way they positioned arms and from hearing about this online. The degree to which I felt the shoulder pain did surprise me. So it's a lot stronger, a lot more pain than I was expecting. I am currently just using T3s, so 2 of those every 4 hours to manage the pain, and that is I guess primarily because of nausea. I've tried stronger medication, I've reacted badly to that, and quite frankly I'd rather deal with a bit more pain than with just sitting on the verge of throwing up for hours on end or days on end. So it's just T3s, a bit of Gravol, which is anti-nausea medication, and then calcium, vitamin D, and those types of supplements. So again, it's Sunday. The operation was this past Wednesday, and I'll hopefully give some more updates in the future.